Hello, I'm Sarah Willock. I'm Head of Healthcare at BLM, and I'm joined today by Jane Lang, one of our healthcare partners in the Cardiff office. This is the first part of our look at what legal processes there might be to help us understand what's gone on in the first wave of the COVID pandemic, and which might inform the responses of health and care workers, care homes and other organisations in what may be to come in the form of a second wave or series of spikes in cases. Now, depending on the figures one refers to, it's said that there might be up to 60,000 excess deaths in the UK attributable to COVID. And it's also now being said that there may be thousands of other deaths which, although not directly caused by COVID-19, may be associated with the measures taken to address the COVID crisis. Now, Jen, when one looks at deaths, the immediate tool of inquiry which comes to mind is an inquest. Would there necessarily be an inquest where a death is thought to be caused or related to COVID?
Not necessarily. The coroner's rules and the Act suggest that death must be investigated when there's reason to suspect the deceased died an unnatural death. Now, an unnatural death, you'd think, would be quite simple, but it also is a case where the death has resulted from a naturally occurring condition or disease, in this case COVID, but where there has been some human error that may have contributed to the death. So yes, COVID, but only if there is some form of error that could be dealt with. The Chief Coroner issued guidance in April this year, which suggested that most COVID deaths would not be going to an inquest. But he has recently updated his guidance so that the coroner can hold an inquest into a COVID death where there has been perhaps clinical failings, failure to provide PPE, or concerns in the course of employment. The Chief Coroner is quite clear, however, that inquests are not suitable for those high governmental or public policy decisions that have been made that lots of people will really want to be looking into.
Yeah, I can see then that there really are quite significant limitations and restrictions on what an inquest, or even if there were a series of inquests, what could be done in these circumstances to inform future action. And of course, I guess you would have several different coroners having their own inquiries, and obviously they may have different approaches to how they conduct that inquiry. Absolutely.
There's meant to be some consistency, but each inquest just looks at that particular individual death. There may be cases in a particular coronial area where the coroner decides to hold sequential inquests and deal with their conclusions at the end of having heard all the evidence, for example, in deaths relating to a particular local care home. And of course, coroners do need to have a look at risk to prevent future deaths, but they are particularly limited to the particular facts of an individual death.
Okay, so to sum up, there might be an inquest if the death is caused as a result of contracting COVID in the course of employment. Yes. Where there's any question that there might be some failings in the clinical care and maybe some systemic failings, for instance, failure to provide appropriate PPE for healthcare staff, etc. But really we're looking at particular deaths, not necessarily groups of deaths, although there might be circumstances in which that could occur.
That's right. And systemic failings can only be looked at in relation to specific deaths in Article 2 inquests where the state is involved.
Thanks for that, Jane. And thank you for joining us today. In our next instalment, we'll be looking at what a public inquiry into COVID might look like and what the pros and cons of that might be, and also how those who might be involved in it might prepare now. Thanks very much.